Consists of the monobaryum, body, and xiphoid process. As you know, some of the lips are going to articulate with the sternum directly, such as the first, such as the second, third, fourth, fifth, and sixth, and seventh. What about the others? Indirectly means the tens go up, join to the 9, 9 go up, join to the 8, and 8 go up, and join to the 7, and through the 7 costal cartilage it is going to attach to the sternum. Here is the monobaryum, here is the sternal angle. Sternal angle. As you know, the sternal angle is a landmark for the second costal cartilage. Means if you find the sternal angle in the body of your patient, it convex anteriorly. So if you put your finger here and go laterally, you will be able to find the second costal cartilage, and it is going to help to you to count another costal or the ribs. Here you are going to look at one of the
Vertebra.
that belong to the cervical region, because only the second cervical vertebra has a projection dens. It has a dens that project upward. We call axis. The first one is such as a ring and never has any body. About the cervical vertebra also you can use from another landmark. If you notice to transverse process, a foramen is visible here. A foramen is visible here. This foramen is visible only in the cervical vertebra. Now I am going to show you one of the, if you notice in transverse process, are you able to find any foramen in the root of the transverse process? No. And also, when we are going to look at to the thoracic vertebra, we can find that the body is heart-shaped, the vertebral foramen is circle, and also when you notice to the spinous process, it is downward and obliquely. Okay, it is narrow, downward, and back part obliquely. Another item, yes, you can use and look at to the superior articular facet. Look at the superior articular facet. This form of articular facet help to the thoracic vertebra to do the rotation. Now, if I bring the lumbar vertebra, look at the difference between the thoracic and lumbar vertebra. The body size is going to change. The body shape is going to change to the kidney form. Here is heart shape. And also, the vertebral foramen is triangle. Another thing, you can look at to the spinous process. It is quadrangular and go backward horizontally. It is quadrangular and go backward horizontally. Quadrangular spinous process that directed backward horizontally. And another thing, compare the superior articular process of the lumbar vertebra with the thoracic vertebra. Look at the thoracic vertebra, it is smooth, but for the superior articular process of the lumbar, it is concave here. This concave is because of this bony process. This small bony process we call mammillary process. We call mammillary process. This small bony process that attach to superior articular process of the lumbar vertebra we call mammillary process. The mammillary process make the superior articular surface concave, but in the thoracic region the mammillary process are absent. So we never find any concave articular facet. Here is difference to the superior articular process of the lumbar region. And again, here we are going to look at another lumbar vertebra. What do you think about this?
Thoracic.
Thoracic. This form of the spinous process help to you. This form of the superior articular process help to you. The size of the body help to you to remember. In the thoracic vertebra, another landmark that you should notice is the articular facet in each side of the body. This articular facet, sometimes it is completely, sometimes there are demifacet.
Large and small demifacets.
Yes, these articular facet in each side of the body depends that you are going to read about study which of the thoracic vertebra. Sometimes for the first thoracic vertebra you can find a circular completely facet. For the 10th, 12th and 11th also the same, but about the typical you can find two demifacets, superiorly and inferiorly. And about the vertebra you should remember the pedicle, lamina, the spinous process, transverse process, superior articular process, inferior articular process. Please notice to the direction of the superior articular process facet backward, and inferior articular process the facet is
Forward.
forward or toward. Here is the superior articular process and inferior articular process. The direction of the facet, articular facet are different. Superior look posteriorly, but inferiorly look anteriorly. Okay? So the pedicle will be here. In your exam, it is possible I told you, show me a thoracic vertebra, or show to you and ask you, it is a vertebra that belongs to which part of the body? You should explain that it belongs to the thoracic vertebra. It is possible I ask you, show me the inferior articular facet, superior articular facet, transverse process, spinous process, lamina. In the first 10 thoracic vertebra, if you notice to the transverse process, you are able to find articular facet. These articular facets are visible here. So it means that this vertebra is one of the first 10 vertebra, thoracic vertebra. Now about the rib, look at a typical rib. A typical rib is such as this. It can be such as this. Now how we can find it belong to the left side or to the right side? At the first, this part is posterior end and this part is anterior end. Now we know that in the external surface and internal surface, in internal surface we can find a costal groove. This costal groove should direct it inferiorly. So if I put this here, it is wrong. So it belongs to the left side. Now in the left side, it is head, neck, tubercle. Tubercle, you have articular facet and non-articular facet. Where is the angle? Angle is where that the rib is going to make curve. Here is the angle. Look at here. So if you come down, when you come down, go to the 6 to the 7 ribs, this angle is going more far from the tubercle, but this is near the tubercle. So I think it belongs to the superior ribs. Now about the 12 rib, look at the 12 rib. The head has completely facet. Are you able to find any tubercle?
No.
Are you able to find any costal groove?
No.
Are you able to show me the neck? No, because the tubercle is not here. And it is very short. About the first, about the first ribs, look at here, it is posterior end, anterior end. I told you it belongs to the atypical group. Superior surface, inferior surface. Posterior end, anterior end.
This is the first rib?
Yes. Look at it is very short and more curved. It is the only rib that has more curve. lateral border, medial border, superior surface, inferior surface. In superior surface, you are able to find two grooves, posterior groove, anterior groove. From the posterior groove, we know that the subclavian artery is passing here. From the anterior groove, we know the subclavian vein is going to be found here. And here is a crest. If you go medially, here a small tubercle is visible. You can see that it is the escalent tubercle. It is possible, I told you, show me escalent tubercle. You should know escalent tubercle is visible in the first rib and in the medial border. Posteriorly, head, neck, tubercle. Look at to the angle. Angle is the same place that the tubercle is, because here it is going to make curve. But in the second rib, third rib, the angle is going far from the tubercle. For the first rib, tubercle and angle are both of them in one place, in one area. Now about the sacrum. If you look at the sacrum, these are real, but it is not real. It is the molar. It is real. Okay? This is the sacrum. If you look at the sacrum, it is dorsal surface or posterior surface, anterior surface. Because at the first, the sacrum consists of 5 segments, so 4 horizontal lines are going to be found in anterior surface of the sacrum. 4 horizontal lines are visible here. If you look at here, the anterior surface is concave, and 4 pairs of the foramen are visible. Posteriorly, 4 pairs of the dorsal sacral foramen are visible here. In the posterior surface, dorsal surface, you can find the median sacral crest, medial sacral crest, lateral sacral crest. Remember, median sacral crest is joining fusion of the spinous process. You know the last sacral vertebra, the lamina, disappear and make a hiatus here. What's the name of this hiatus? Sacral hiatus. What's the name of this part of the sacral hiatus? Sacral horn or sacral horn. Okay? Now, the medial sacral crest is going to be formed by joining fusion of the superior and inferior articular process. The lateral sacral crest are going to be formed by joining fusion of the transverse process. Laterally, superior is wide. When it is going inferior, it is going to get narrow, thinner. Superior, you can find an articular facet. This articular facet is auricular shape. It is auricular shape, such as the ear, auricular shape. This auricular surface is going to make joint with the auricular surface of hip bone and make sacroiliac joint. Now, about this, if you notice, you are able to look at the clavicle, sternum. It is midline.
There's section of
Yes, section of midline, anterior midline, costa, rib, costal cartilage, intercostal space, and if I rotate medially, I am able to show you diaphragm and one of the lungs. Here, in the moulage, you should know, you know this muscle.
Pectoralis major.
If I remove the pectoralis major,
Pectoralis minor.
Inside of the intercostal space, intercostal
Muscles.
muscle, and also one of the muscles that attach and the stratus anterior is visible here. It is some part of it is here. Some part of the stratus anterior. Now, if I remove and look at posteriorly to sternum, the transverse thoracic muscle is visible here. Transverse thoracic muscle is visible here. Another thing, it is not a real but help to you. Look at this vertebra.
Doctors.
How do you think?
Atlas.
I think that
You know, what do you think?
Atlas.
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 Are you able to find and show me the body?
No.
Body.
There is
No.
nobody.
There's no one.
And also belong to the cervical. Look at this foramen in root of or base of the transverse process. And the other I explain for you after the class. You can read by yourself. Here, you should be careful about the bone, about this moulage, because your mother and father read and became the doctor. Now your son and your girl, your baby, future are coming to this university and wanted to use from this bone, from this moulage. So be careful, because if be in healthy and normal, everything you can find. But if you throw down something broken, and it will be make problem for this bone, and it make problem for the student to understand and distinguish every detail about this bone. This posterior or back. Here I am able to show you trapezius and this muscle, latissimus dorsi. If I remove this muscle, I am not sure, but here we are going to look at the medial border. We are going, thank you. We are going to look at the medial border of the scapula. Which muscle in the superficial
Deviator.
layer deep to trapezius is visible here?
Rhomboid.
Levator
Levator scapula.
Rhomboid
Minor.
major.
Major.
Major. Okay? And another muscle you are going to study in the upper limb. You know everything. The latissimus dorsi. If I remove the latissimus dorsi, you are able to look at
Serratus.
the posterior, inferior serratus. Posterior, inferior serratus. And
It's inferior.
yes, here is the erector spine. These belong to the erector spine. Be careful about this. And this, you know, when you remove the skin inside of the superficial fascia, you are going to look at two mammary gland or breast. And if you remove the superficial fascia, you remove the mammary gland too. These structures are anterior in front of the pectoralis major. Now, what's the name of this muscle?
Serratus anterior.
I go up and I go there. I explain for you. Okay. You are going to look at the common carotid artery, the internal jugular vein and the left subclavian vein join to each other and make the left brachiocephalic vein. In the right side, the internal jugular vein, the right subclavian vein join to each other and make the right brachiocephalic vein. The right brachiocephalic vein, the left brachiocephalic vein are going to connect to each other, join to each
Superior
other to the
vena
right
cava.
side. So the left brachiocephalic vein is longer, taller
And the
than the right.
right.
Both of them join to each other to be able to make the vena cava superior. Here the diaphragm is visible, and you are going to look at the hiatus of the esophagus. Here is the hiatus of the aorta. And this foramen belongs to vena cava inferior.
Inferior.
What's the name of this yellow group?
Spinal cord.
Spinal
Spinal
nerve.
nerve. This is intervertebral disc. This moulage wanted to show you the herniation of intervertebral disc. It is going to compress this nearest nerve. So this patient has pain at the length of this nerve. And if you notice, you are able to look at to the curve of the
Spine.
vertebral column. convex anteriorly, concave anteriorly. In the lumbar region again, convex anteriorly, in the sacral region, concave anteriorly. And posteriorly, you are going to look at spinous
process.
Spinous process in the lumbar region are quadrangular and directed horizontally. So, help to you to be able to pass a needle here and
Lumbar
access
point.
to the vertebral column for
Lum.
getting a sample
LP.
of the CSF. Do you have any questions?